Which of the following is a common association with this condition? So a full-term newborn presents with bilious vomiting and abdominal distension shortly after birth. The baby has passed meconium within the first 24 hours of life. Physical examination reveals a distended abdomen. The X-ray shows dilated loops of bowels consistent with proximal bowel obstruction. During surgical exploration, a blind ending proximal jejunum and a separate distal segment ending blindly were identified. So just from that, I think we have like an atresia going on,
Okay.
right? Just because of the blind ending. Um, and I think I should know this because I just went over it. But if I'm not mistaken, those are associated with trisomy 21.
Okay. Final answer.
Final answer.
Okay,
Ooh.
let's see here. 21, including cardiac, intellectual, facial, however, is not. So this is a jejunal atresia. Okay,
Mhm.
100%. You got the diagnosis correct. Okay, even I couldn't remember, to be honest with you, what it's associated with. So This is like you're 80% there. Does that make sense? What I'm saying? So
Yes.
getting the question wrong is not a big deal. I know that sounds really weird, but you got the diagnosis. You said it's atresia, right? Jejunal atresia, which is correct, right? So it says
Mhm.
bilious vomiting, abdominal atresia, right, is a proximal bowel obstruction, surgical findings, blinded jejunum, separated, connecting a jejunal atresia, commonly associated with cystic fibrosis, as thick meconium can cause obstruction and ischemia in utero, leading to atresia. So that's a good association to know, right? We'll kind of work with the rest of it, right? Trisomy 18 is Edwards syndrome. Kind of, we learned this a lot, right? Cardiac defects, micrognathia,
Mhm.
rocker bottom feet, right? But not dealing with jejunal atresia. Trisomy 21, everyone usually remembers trisomy 21. Turner syndrome, right? One X chromosome, stature, web neck, gonadal dysgenesis, and can give cystic hygromas, but no jejunotresia. And then neurofibromatosis type 1, right? You get cafe au lait spots,
Yeah.
neurofibromas, right? But not jejunotresia. But learning point here, right? Just remember that, okay, if you have jejunotresia, which you already knew the diagnosis, you just have to remember that it can be associated with cystic fibrosis. That's all.
Fibrosis. Okay.
You see how
Um.
it's an easy fix now?
Mhm.
Okay. All right.
I see. I see where you're coming from.
All righty.